Hi, Nurse Sherry here, and today we're going to be going over the CNA Testable skills, empties a urinary catheter. So the first thing you need to do is make sure that you check what state you are from, because of the facilities are different that you have to take your skill evaluation at. You would have Prometric, Credentia, Pearson VUE, Henderson, but this should be the same for every state. So when you're entering these, a few things you want to know about your catheter before I even start the skill is you want to check to make sure every time you come in the room, or especially when you're going to empty it, that this catheter is not kinked or it's not sitting underneath the leg, because this could cause a pressure ulcer, especially this piece right here. It's very hard, and so if that's under someone, that could cause a sore or a pressure ulcer. The next thing I want to look for is to make sure that they have some sort of device that is holding this to the patient's leg. Paper tape is okay, transparent tape is okay, but it's nice if you get these stat locks. Some facilities don't have everything you want, but this is a stat lock, and so how it's placed in there, just in case, you have this button off to the side here, and you just kind of push it in. So this piece and this piece just need to go in, and you can't put it on backwards because you can tell that this has more room and there's not enough over here. So it would go this way, and then you close it. And what that does is it keeps it in place. So if the patient moves around, you can see it's not gonna tug on this catheter if the patient's moving around at all. And that tugging causes bladder spasms and very discomfort and dysuria for patients, which is painful when they're using the catheter. But that they usually have pain in the urethra anyways when they have a Foley in, so we would definitely want to decrease that. All right, another thing about Foley catheters is that the bag needs to hang on the bed frame, not the bed rail, because this is movable and that could harm the bag or interrupt it. And you want to make sure that your Foley bag is always below the bladder of your patient. Those are some main things, and those are good written question tests that they will ask you as well. All right, let's get started on the skill. All right, so the first thing I'm going to do is knock on the door, provide privacy, wash my hands, introduce and identify my patient. So, hi, my name is Sherry. I'll be your CNA today. Can you verify your name? All right, Robert, we're going to empty your urinary catheter. Would that be okay with you? All right, wonderful. All right, I'm going to go ahead and apply my gloves. I'm going to lift my sleeves up. So if I did have a jacket on at work or a long sleeves underneath my scrubs, you want to make sure that you lift those up, because you don't want to get any bodily fluids on your clothing. All right, I place these on. I'm going to grab my incontinence pad, and I'm going to lay it underneath the Foley catheter. Then I'm going to grab my graduate container and my alcohol wipe. Some states require the alcohol wipe and some don't, so I'm going to show you with it. Just check your steps in your facility. All right, so the next thing I'm going to do is make sure that this is all out and everything looks like nothing's kinked and it doesn't look abnormal. I want to make sure that this button right here is pressed in, because if not, and this, when I go to open this, the urine will come on me. So I don't want that. So I want to make sure that that is closed. Then I'm going to just take this clip. There's different kinds of catheters, but for this one, I'm going to take this clip. I'm going to place it in the graduate container without contaminating it. So I don't want this to touch any part of the graduate container or my gloves or anything when I'm doing this, like the inside of it. So then I'm going to take this and I'm going to open it up. It's just a little pinch down, and I'm going to open it where there's no kinks and allow all the urine to come out. And sometimes you might need to move the bag around to make sure that you get everything, because some people are on strict INOs, and anybody with a Foley catheter would probably be on an INO, so that we make sure that we are tracking how much that they have a balance in their fluids. All right, next I'm going to clip this right here. I'm going to pull this out. I'm going to take my alcohol wipe and just wipe this off, because the urine got all on it as it splatters down. So I just kind of clean this area up, and I'm going to place it back into this area, the holder, and make sure that it's clamped down. So that is clamped, that is clamped. All right, the next thing I'm going to do is take my urine over to the toilet area, and I want to place it on an area that is a flat surface so that I can read it. So I place it down. As you can see my numbers here. I wait until this settles because if it's moving around, you're gonna get a wrong number, and you need to be within 25 mils of what your evaluator sees. So these go in 25s. So right here I see 100, and then I see 150, and it is on that line in between that. So this would be 125 mils. So the next thing I'm gonna do is take my urine, I'm gonna empty it in the toilet or bedside commode. I'm gonna take my graduate container to the sink. I'm going to add some water, swish it around. I'm gonna empty that, the contents of that, into the container. I'm gonna place this in my dirty area, supply area. I'm going to come back, I'm going to remove my gloves by pinching the palm of the hand of one, placing the glove into this hand, tucking my fingers under there so that all the dirty is inside the glove. I'm gonna go ahead and dispose of that. I'm going to wash my hands. I'm gonna come over and I'm gonna take my INO recording sheet and I'm gonna document urine output, because that's one of my testable skills, 125 milliliters. Now, in real life, when you're doing this, you wanna make sure that you also document or notify the nurse if the clarity, if it's not clear, if you see sediment inside of the urinary bag, if the urine is dark brown or amber, maybe the patient's not getting enough fluid, or maybe they're in kidney failure. So we need to just make sure that you're communicating things for the nurse. And if you notice any strong smell, also you might want to notify the nurse, because the patient could have a UTI, and those can happen with Foley catheters as well. All right, well, thanks for watching my video, and have a good day.